Yes, then the curvatures. As you can look, if you were to look at somebody standing upright in anatomical position from the side, from the lateral side, usually there are curvatures so that your spine or vertebral column is not straight all the way. It is not. In fact, if it is all straight, then there is probably a problem. There are some curvatures. Yeah, and then you can see in a newborn, usually when the fetus inside the uterus, they are usually in almost a curved position, as in the head and the knees are almost touching. So there is that curvature. One curvature that is, if you are to look at it from anterior, from the front, it is anteriorly concave. Yeah, anterior concavity. It's one anteriorly is concave. If you look from posterior, it is more convex, and it is one curvature all the way from the neck all the way to the coccyx. So that is in a newborn, that is generally the curvature. And generally, when you look at a newborn, they have that posture. Yeah. So when the child grows, as they grow, as they start being able to control their head, when you do pediatrics, you'll be able to know the milestone, the various milestones that we talk about. That at one point the child should be able to control their head. So at around 3 to 4 months, the baby should be able to hold up their heads steadily. And then at that point, the cervical curvature starts forming. And you can see, looking at it from the front, from anterior, it is more of anterior convex anteriorly. Anterior convexity is convex anteriorly. Because if you look at it from posteriorly, it is concave posteriorly. That is now the cervical curvature starting to form as soon as the baby start being able to control their heads. Once they are able to hold their head up steadily, then that curvature start forming. Yeah, so this curvature that a newborn has, we call it primary curvature. So these others that form, like for example, the cervical curvature that start forming is considered as secondary curvature. So at 3 to 4 months, the cervical curvature start being visible because the child is starting to be able to control their heads. Yeah, and then you can see for an adult, you can see the curvatures that are there. You see the cervical curvature, there is the thoracic curvature, there is the lumbar curvature, and then there is the sacral curvature. So 1, 2, 3, 4 curvatures. Remember the primary curvature is that of a newborn. That is anterior concavity all the way from the base of the skull all the way to the coccyx. But in this case, you can see the secondary curvatures in this case will be the cervical curvature and the lumbar curvature. The lumbar curvature looking for the cervical curvature looking for from anterior, it is convex anteriorly. When you look also at the lumbar curvature, looking at it from anterior, from the front, it is convex anteriorly. Of course, posterior will be concave. Likewise, so those are the two secondary curvatures that form, the cervical one and the lumbar one, lumbar curvature. So see the thoracic one maintain that primary curvature, and also the sacral. It retains that anterior concavity. The two of them are maintained. So the one that form is the cervical and the lumbar.